Welcome, all my Winter Streak friends. It's good to see everyone again. We have two more workshops left, including this one, and I'm excited. Thank you, Ron. Excited to welcome everyone to today's workshop. As a reminder, if you would be kind enough to put your first and last name in the chat, that allows me to track attendance. Also, make sure that you get an entry into the raffle for the end of the program, and expect an email tomorrow at some point with the recording from today. We'll send that out to anybody who registered, including it'll include a workshop evaluation, and we always appreciate the feedback on our workshops. So with that, again, I'll welcome everyone, and also welcome Sam Stover from the Heart and Vascular Center in York. She's going to be our Winter Streak presenter today. Sam, I'll turn things over to you and let you introduce yourself and get started.
Wonderful. Well, good afternoon, everybody. Thank you for joining me today, and Kim for hosting this series. This is a great opportunity, and I'm very thankful to be a part of this. Like Kim said, my name is Samantha Stover, and I am the Heart Health Program Coordinator at WellSpan Health. Today, our discussion is going to be talking about heartfulness. So we will be discussing lifestyle habits and its impact on heart health. Heartfulness, what is it? What does it mean to you? And how to make a lifestyle change to promote a heart-healthy lifestyle. Heart disease remains the #1 cause of death in the US for both men and women, which accounts for approximately 697,000 deaths a year, which is about 1 in 5 of these deaths. So 2 out of 10 of these deaths from coronary heart disease happens to adults less than 65 years of age. So it's definitely a younger population that is being affected by coronary heart disease. And then also knowing that 2 out of 10 of those deaths are less than 65. Another scary statistic is someone in the US has a heart attack about every 40 seconds. So I don't know how long our presentation is going to be, but if you kind of put that into mind, about almost every 40 seconds to a minute, someone would have a heart attack during this presentation. It's super scary. So why is heart disease so prevalent? As you can see on the map here, the dark red is the heavily populated and heavily dense areas with heart disease, and then it kind of spans out from the colors. So it's definitely very, hopefully a known thing that people are aware about, and obviously you're here today to learn more about it. So this is kind of a busy pyramid, but I promise that I will hopefully do a good job explaining this to you. So a lot of information that is provided to the public discusses what we call primary prevention. So primary prevention is very important. However, there's something prior to that. There's a phrase called primordial prevention, which actually comes before primary prevention. If you are unfamiliar with these terms, primary prevention is modifying or treating risk factors to prevent a disease. For example, you have poor eating habits since childhood, or you started smoking at a young age. These factors are already in place, even if you've not been diagnosed with, say, high blood pressure or heart disease. Primordial prevention is eliminating these risk factors or avoiding the development of these risk factors prior to a disease progression. So this starts at a very young age. Examples of this are, limiting processed foods from early on, not smoking or not being around someone who is a smoker, and being physically active. So what is the most important thing to note from this pyramid is that no matter where you fall, whether you are in the primordial, the primary, or the secondary prevention part of this pyramid, you can make adjustments to your lifestyle modification to either, 1, eliminate the risk of chronic disease, lessen the worsening of a chronic disease, or even early death. So who is at risk? You see these 2 individuals here. You see a man and a woman. By the looks of them, they look and appear to be very healthy. But heart disease can happen to anyone, which is why knowing what your risk factors are is so important in the prevention of heart disease. So I'm going to just kind of give like a general explanation of each person, and maybe if someone wants to chime in or in the chat. I don't know how interactive we can make this be, but just to see who or what part of the pyramid they fall in. So let's say this girl, her name is, let's go with Liz. So she was diagnosed with high blood pressure yesterday and started exercising today. Where do you think she would fall on this pyramid? I'll go back so that people can kind of look at where it is. So diagnosed with high blood pressure yesterday. Prior to that, wasn't really living a good lifestyle. And now after talking with her physician, he's like, you need to start exercising and eating right. So where do you think she would fall? That's okay if you don't know. So we're going to say we're in the primary prevention. So she, like I said, has had those risk factors. They've already been developed. She now has high blood pressure. So right now, what she really needs to focus on are some lifestyle modifications. Like I said, eating right, exercising, making sure that she's taking her medications if she was prescribed them properly, and then, hopefully doesn't end up having a secondary event. So this gentleman, say we'll call him Ken, and we'll say he retired from the Army about a year ago. Unfortunately, due to his family history, he had a heart attack and had to have a triple bypass surgery. Where do you think Ken falls on this pyramid? Go back for you. So unfortunately, his was a little bit frustrating because he was otherwise thinking he's doing the right lifestyle changes, but he does fall in the secondary prevention category because he did have a heart attack and needed stents. Or needed a bypass surgery. So in that case, he would fall in the secondary prevention. So really the bottom line that I'm trying to get to you is that these two individuals are in very different areas of prevention. However, the important thing is that they are taking steps to control their health. So knowing that if something has happened to you cardiac wise, or diagnosed with diabetes, there are things that you can still take into control to help lessen the severity of the disease and or early death. So we talked a little bit about risk factors and the different preventative measures. So really there's two different categories with risk factors. There are things that we call non-modifiable. So these are things that we cannot change. These were things that we were kind of given to at birth. And then there's things that we have that we can change, or modifiable, things that we have done in our life that have caused this potentially disease to occur. So some examples of non-modifiable risk factors would be at your age. Unfortunately, we all will age, and as we get older, our risk for heart disease definitely goes up. Our gender, now men and women alike is the number one killer. Heart disease is the number one killer. However, when women hit menopause, unfortunately, their risk goes up even higher. Your ethnicity. So Black Americans are more likely to have a heart attack than white Americans. Family history. So if you had a male relative or a female relative that had a heart attack at an early age, your risk is high as well. And if you've had a previous stroke or heart attack, those risk factors, unfortunately, probably the modifiable had led to this heart attack and stroke. So something we cannot change that has already happened, that's in our genes, and that's, kind of what we're handling. So things that are modifiable, things that we can do to change or potentially lower the risk of developing are high blood pressure. We can eliminate from smoking or even vaping, obesity, physical inactivity, not exercising like you should, or even just a brisk walk, diabetes, high cholesterol, stress, and alcohol. So I don't know if anyone has any guesses of the risk factors that I talked back here regarding modifiable. What do you think the top 2 unhealthy habits are that lead to early death? So out of the high blood pressure, smoking, obesity, diabetes, cholesterol, stress, alcohol, can anyone take guesses what the top 2 are that causes early death? I'll give you another second to guess. So if you guessed smoking and physical inactivity, you were correct. So, and like I said, these are two risk factors that we can prevent and or eliminate that can definitely lower your risk of disease. And then also, based on the prevention pyramid, this is something that, if we cut out early on in life, then hopefully it doesn't progress to worsening disease. So now that we know there are things that we can do to make changes in our health, we're going to discuss heartfulness and how this is something anyone can adopt and promote their well-being. So I want you to take a second and I want you to think about the word heartfulness. Now, I purposefully spelled it wrong just because of kind of how I wanted to develop this program, but heartfulness is typically with one L. But when I first heard this word, I thought to myself, what makes my heart full? And that's kind of where I got this word from. What makes it full? What makes it happy? Both mentally, emotionally, and physically. So obviously we know there's a lot of things that cause heart disease. So obviously that is something that physically doesn't really help our heart, doesn't make it full, doesn't make it happy. And then emotionally, stress is a huge factor. So that doesn't make your heart full. So the true definition of heartfulness is a heart-centered approach to life. So where you will ideally be able to live each moment by the heart. It is to live naturally in tune with the noble qualities of the heart, enlightened and refined through spiritual practice. So heartfulness also comes from the term mindfulness. And I don't know if these are new phrases or if these are things that you've heard of before, but it basically means just being present in the moment. So I like to think of it as, will this action or behavior I'm about to do provide benefit to my well-being? Am I saying everyone should go out and meditate? No. Now, would that harm you? Probably not. But and if it's something you want to embrace or take on, great things have come from it. And there's a lot of resources out there that can help you succeed doing that. But for me and with my schedule, I really just adapted my version of heartfulness and mindfulness. And then where, I try to incorporate this into my day-to-day life. No one is perfect. We can live in a way that will just promote longevity. And that's my goal. I want to be around. I want to see my kids get old. I want to be able to be active with them. So things that bring you joy and benefit your well-being should be top priority. I want, it may not happen daily. Like I said, life is busy. I definitely get that. But when you get the opportunity, try to participate in an event or habit that, live in that moment, take in those deep breaths and remember how you feel. I don't know, not many people have participated, but I would just have you guys kind of just think of a moment that has really brought you joy in life and how you felt in that moment. Do you remember actually taking those deep breaths and taking it in and enjoying it? Or do you remember just chaos and hecticness and, running around? So just try to find that joyful moment and try to find the most enlightening part of it. And really try to see how you can incorporate that in your day-to-day life. So this is my family. Of course, they bring me lots of joy. I've got little Nolan, he is 4, and my daughter Bexley is 7. But with, hectic schedules and working 2 jobs, I often found myself very stressed. And then my husband took on a new position and is traveling a lot. So, sometimes I'm a one-hand team in the evenings when he's gone. But what I have done to help with heartfulness and mindfulness and lowering my stress is I've started reading, just any novel out there. This is something that helps to clear the stress and the day-to-day life, and it brings me joy. So it has been over 10 years since I finished a novel. And this year, being March now, I've finished 2 books, which if you would have asked me a year ago, if they would have ever pictured me sitting down and reading an entire novel in less than a month, I would have said, absolutely not. No way. There's no way I can accommodate that into my schedule. But I did find a way to do it, whether it's taking, kids to practice or, just in the evening, trying to set aside a few extra minutes just to read. So unfortunately, when you take that time for yourself and you're living in that moment, you're enjoying what brings you joy, it may be perceived as selfish, but no matter what stage you're in, whether you're caring for a loved one, whether you're a dedicated professional or a committed friend, you need to allow yourself to have that time. And by doing so, you're able to actually be more heartful or present in the moment for the ones that rely on you. So to me, I think mental clarity has allowed me to refocus with my family, take a step back and appreciate that time together, and allow my heart to be full. So that's kind of my version of heartfulness. Everybody's will look different. And doing this has actually allowed, like I said, a lot more time with my family, and I've been able to enjoy the moments. And I'm not going to lie, I've been playing a lot of freeze tag. So it's kind of it's great for my heart, and also, gets out my frustration, and the kids have a blast. So, find what will bring you joy, take that time for yourself. That way you can be present for others and be heartful for others. So I did touch base a lot on stress. So, we all want to promote a healthier lifestyle for ourselves. Everybody that's attending here today obviously wants to make some changes in their life or wants to hear more, learn more. We all want to be heartful, but unfortunately, stress is a major factor that can lead to unhealthy behaviors. Generally, we develop these unhealthy behaviors because we are stressed. These unhealthy behaviors may include smoking or overeating or, lack of physical activity because we're so tired, we're so fatigued that we just, can't get off the couch and go for that walk. So these unhealthy behaviors then lead to feeling poorly and increasing our chances of a chronic disease. So to me, like I said, to practice this heartfulness, this can help to eliminate the unhealthy behaviors or habits that are formed by stress, using our heart and our mind to motivate ourselves to take that deep breath. Think about what behavior you're about to perform. Will this help my health? Will my body feel better temporarily? Usually these unhealthy coping mechanisms are usually a quick fix. And practicing heartfulness obviously can help retrain your habits or your brain to think differently. Definitely takes time. It is not easy. By all means, I am guilty of, having moments where I'm stressed and, I forget to think about it. But like I said, it's a slow process, and it's definitely, getting easier as I do it. And it's definitely become a little bit of a healthier habit for me. So at home, if anybody has a blank piece of paper, or you can, do a mental heart, I want everyone to draw a heart in the middle of their paper. All right. So once you have this heart, it doesn't have to be pretty, it's just a simple heart. I want you to write down things inside of this heart that bring you joy, or things healthy habits that you would like to adapt, or healthy habits that you've already adapted. If anyone's made New Year's resolutions and is still with it, being March 1st, put that in your heart. These are all things that are going to make our heart full. They are going to make our heart happy and make us feel healthier and better about, what we've accomplished. And then on the outside of the paper, so in this blank space around the heart, I want you to put down habits or traits that you either want to improve on, or things that you want to eliminate from your lifestyle, or unhealthy behaviors that you've already cut out of your life. So it, will look different for everybody. And I want this very simple activity to just be a reminder of what you need to do to help your heart be full and what you can eliminate to promote your overall well-being. So as you guys work on that, I'll just kind of go over what I put in mine. Obviously, mine's not a written one, but I thought it'd be easier for you to see on the slide. So one of my things I do very well is I drink lots of water. I don't know if you see, I've got this big old jug and I drink it all day long. I think because I have a dry mouth, so it just, is good for me, but I also feel better. I notice if I go a day without staying hydrated, my body just kind of feels a little fatigued. So I've taken that mental note, knowing that, hey, it's a very simple task. I get a big jug, I'll fill it with water, and I feel better by the end of the day. Next thing I do, and am still trying to work on more, is exercising 2 to 3 times a week. Before kids, I exercised every day. Obviously, with my hectic schedule now, I'm happy with 2 to 3 times a week. And honestly, I try to just hit the 150 minutes of exercise a week, and knowing that that is, a heart healthy lifestyle. So that's just another thing that is keeping my heart full. Finding the silver lining in stressful situations. I'd say 95% of the time I am an optimist. I even have a sweater that says optimist on it. Sometimes, life gets ahead of me and I forget, reel it in, Samantha, look at the silver lining. It will work out. And if it doesn't work out, we'll find a way to work around it. So I try to relay that to my kids, especially because I feel like stress and anxiety is a big contribution to children and adults all around. So I really try to, be the positive influence, and also, try to find that silver lining so my kids can also adapt those behaviors. And incorporating mostly fruits and veggies in my diet. I'm guilty during the winter. It's a little bit cold and I don't want to eat fruits and veggies because I'm cold. So I've been really just trying to do some like steamed vegetables and then just have them aside, ready to go for lunch. And then even like soups, just adding it to soups as much as possible. So that's just something that I find I need to work on, or things that are making my heart full, and that would make me feel better at the end of the day. And some of the things that I've left outside of my heart are TV before bed. I made the mistake of purchasing a TV a couple of years ago for our bedroom. And, my husband's probably more guilty of watching TV than I am, but sometimes, you just want to decompress, unwind, watch something that's not a children's show, or, whatever your spouse likes to watch. You get kind of a little break. And so that's kind of where I've adapted reading, so that I could read, take my eyes off the screen and get a break from that. Something else, my husband and I really enjoy entertaining. We like having our friends over, our friends with kids, and I tend to put together these big snack boards. And, by the end of the day, I'm like, oh my gosh, I don't even know how much I ate off that board. So I want to really try to focus on, at dinner time, or, in between lunch and dinner, what we're serving as snacks. And then the last is taking on too much with my children's school. So I do volunteer a lot for them on top of working and exercising and, all those things. But I would like to cut back a little bit. I took on the role of the PTO president, and I'm it's good, but I'm going to serve my 2 years and then let someone else take over. It's just a lot of work and a lot of added stress that I feel like kind of takes away from myself and my family. So besides knowing your risk factors, talking about heartfulness and how you can make your heart full, there's some other things that you can do that are pretty easy as well. One of the biggest things is knowing your numbers. So I'm sure a lot of people have heard this phrase before, and there's 4 specific things that you should really either have checked or have followed up with your physician if you don't regularly. The first one is your total cholesterol. So a healthy total cholesterol is really patient specific. You can talk to your provider about that and what is healthy for you. And if you're on cholesterol medications, making sure that you're taking it like you should. And or if you're on the verge of having high cholesterol, maybe, trying to add some exercise and trying to eliminate some processed foods. The next one is blood pressure. So a healthy blood pressure is less than 120/80. This is super important that you have your blood pressure checked. And it's also very important that you have it checked correctly. Unfortunately, there's a lot of factors that play into a false reading, whether it be high or low. So making sure that if you have a blood pressure cuff at home, that you do it the same time every day. You keep a log of those numbers. You have your feet flat on the floor. You're hopefully relaxed. Ideally, you should not have had anything to eat or drink, and you should have used the restroom. Anytime you eat or drink or have a full bladder or cross your legs, it can definitely affect your numbers. So that's also why it's very important to try to do it at the same time every day and keep that log, so that you can take that log into your physician and say, hey, I've noticed my numbers are starting to trend up. Should I be worried? And they might want you to keep a closer eye on it and making sure that you're doing it correctly. The next one is your blood sugar. So a healthy fasting glucose is less than 100. So fasting means, not eating or drinking for at least 8 to 10 hours prior to having that lab drawn, or a hemoglobin A1C of less than 5.7. A hemoglobin A1C is usually a better indicator of if you have diabetes, borderline diabetes. It's basically a 3-month synopsis of your blood sugar. So your physician may order just a fasting glucose, depending on that, then may order hemoglobin A1C. But they're both very important, and both, if you haven't had them drawn, maybe ask your physician, hey, can you order this for me so that I can see what my numbers are. And then the last one is a body mass index. So there is a huge calculation that you can do, or you can go on Google and find a BMI calculator. And that's what I do. I mean, you're welcome to test your math skills. I don't, but I think for me to get the most accurate, I'm going to use the BMI calculator on Google. So basically it takes into your account your height and your weight. And it gives you a percentage. So a healthy BMI is 18.6% to 24.9%. So based on that number, that's, like I said, where you should be. And then if you're higher above that, there are different categories, whether you're in the overweight or obese or severely obese category. Some other things that you can do, you can also know the warning signs of a heart attack. So, that's a big warning. Knowing these signs, one can save your life. Or can save someone else's life. So a heart attack is definitely a life-threatening emergency. Every second counts. If you think you're with someone or you are potentially having symptoms of a heart attack, call 911. Don't wait. Don't drive yourself. Unfortunately, a lot of women especially tend to push off the symptoms. They have other things to take care of that are more important. You need to be seen. So don't, like I said, do not put it off. Some, heart attack symptoms, obviously we all think of chest pain or discomfort, or you feel like something's sitting on your chest. That is definitely the number one symptom. However, there are so many other things that you can experience, especially in women or elderly, and even people who are diabetic might display other symptoms because of their health conditions. So knowing that you can have pain in your jaw or even in your back, you can have what feels like indigestion or reflux. You can feel short of breath. You can have nausea, vomiting. I did a talk one time and the lady says, well, I have back pain all the time. And I was like, well, back pain, if it's something you're used have chronically, and that is because of, a fall or you were in an accident. If it's something outside of what you're used to, then you should seek treatment. Now, if it's your chronic back pain, that it's exacerbated when you are sitting for a long period of time. Maybe try to stretch, see if it helps. But I would, seek attention if it's anything outside of what you're used to feeling. And like I said, fatigue, a lot of times people are like, I'm just so tired and I don't know why. So that could potentially be, something related to your heart. So it's very important to know your numbers and then also to know these symptoms. And maybe if you have a physician that you can get in touch with, to have all this stuff done prior to know your risks. And the next thing I wanted to incorporate with this, because, stroke and heart disease kind of go hand in hand. So, I want everyone to know the signs and symptoms of a stroke as well. So, for a stroke, time is brain. That's a phrase we use very commonly. So it basically means that also, like with a heart attack, you should seek treatment immediately. And it's very important to know when this first symptom started or when the person was last known normal. There's this medication that we can give you when you come into the hospital for a stroke that, within 4.5 hours of, the symptom starting, we may be able to give you this drug, and then hopefully it can lessen your symptoms. And, between, let me see. Oh, yep, here it is. We use an acronym called FAST. So FAST. F stands for face drooping. So if you're talking with someone and you notice one side of their face is, their mouth is starting to droop a little bit, or even in their eye, that's a sign that they could potentially be having a stroke. Arm weakness. So if you have them put their arms out and maybe one's drifting and they can't hold it up, or, they're not really walking right, something just seemed off. Sometimes people can be slurring words, or they could have a hard time expressing what they are trying to say, or even interpreting what someone's saying. That's a form of aphasia. So speech difficulty, and T, like I said, time to call 911. So it's super important that, if you see these symptoms in yourself or someone else that you seek treatment. What's great to know is that the Heart and Vascular program at WellSpan is phenomenal, and they have amazing physicians that are on board and, will take wonderful care of you. And then also with our York Hospital is a comprehensive stroke center, and the other ones are primary stroke centers. So if you're local, know that these hospitals are doing whatever they can to hopefully help you if you come in with any of these symptoms. And the next thing you can do is you can get involved. So like I said, WellSpan has insane amount of resources available for you. And myself and Dr. Barclay, one of the cardiologists, we do a walk every month. It's called Walk and Talk with the WellSpan Doc. And he's a great guy, super personable, 6 foot something. He's super tall. So if you ever come out on a walk with us, you won't miss him. But he just tries to promote, walking, introducing you to different parks. And, he always has this saying that whenever he prescribes walking to a patient, they never complain. He's like, I'll take it any day. So, we have that opportunity for you to come out and walk with us. It's a great time. We go to different locations, and it's, every month, and then we'll go indoor in the winter. And then one of the dietitians, Christine Lutz, does a Heart Healthy Express class. These are all free. So you can register for them online. And then there's also a health risk assessment quiz on the website, along with this huge amount of things that Heart and Vascular does for you. So that is the end of my presentation, but I really just want to thank everybody for coming out. Hopefully, you're able to adopt some of these lifestyle changes and live a heartful life, and hopefully, promote longevity.
Thanks, Samantha. I had a quick question for you. Do you and Dr. Barclay make it out of York County ever, or do you mostly stick to York County with the walk with the doc?
So we have gone to Hanover a couple of times. If we're asked to come, we will by any means, try to coordinate with schedules and go where people, would like to go walk. We did it at the Hanover YMCA, and then there was a section of the rail trail in Hanover that we walked at before as well. So
Okay.
I guess that's part of York County, but I guess, we would be open to exploring other places as well. So if the want and need is there, we're happy to try to accommodate. So
okay, great. We have folks from across many counties, so just wanted to ask that question. Does anybody have any additional questions for Samantha? Her email is there. You can email her directly. You can always reach out to me and I can connect you. We will be back tonight at 5:30. I invite you to come back at 5:30, or at least suggest to friends and family that they attend. This is a wonderful presentation. Samantha, thank you so much. And I'll see you guys at the next Winter Streak workshop.
Thank you.
Take care, everyone.
Thank you.